We have been looking for MRD for a long time. In fact, the Spanish myeloma group, we were some pioneers in this field of MRD, both by NGF, particularly in the Spanish myeloma group, but also by the NGS, by molecular things. And I think this is very important because we are able to have now a better quality of responses and to evaluate and to be able to know how these patients are responding. And this has always have had a prognostic influence, that we know that those patients with MRD positivity do worse than those patients in which we are able to eradicate all the minimal residual disease with the highest sensitivity levels. But we needed a step forward, and it was to take decisions based on MRD. And this is something that we are now doing, and we are starting to do, to treat differently or to adapt treatment based on the MRD situation and positivity or negativity. And in fact, now we are able to adapt the maintenance. Probably this is something we also take into the equation to stop treatment maybe, or it helps to stop treatment in those patients with MRD negativity. We can stop treatment, or in those patients that are MRD positive, we should continue. I think this is very important because this is usually an aggressive technique, but with that, if we are able to make this help us manage better our patients, this would be also interesting. And the other field investigation, in fact, well, I have to say that now very recently it has been approved by the FDA, the MRD, as an endpoint for clinical trials. So we don't need to have a PFS now, but probably MRD, which is a vast faster, and we can have it earlier. We will be able to have MRD as an endpoint. And as I was saying, the other point important here is to try to evaluate MRD in a different situation, probably in the peripheral blood or with other techniques that are better, more accessible for patients.